When talking with your oncology patient, the most difficult issues to discuss are prognosis and the cost of treatment. At the 8th Annual Chicago Supportive Oncology Conference, Dr. Tony Bach shared some communication tips for these difficult conversations.
I think there are a couple of really important things for oncologists to remember. One is that everything you say might not be received in the way you think it will. So you feel like you've done this big explanation, but it didn't quite land. And so being aware that that is really common, it's not in fact the it's not in fact the exception, it's the usual thing. That's the thing to be clear about. The other thing is that the fact that the information that we give is so often emotionally loaded, that interferes with people's ability to process that. And so it's important to be aware of that too, because when there are big emotional moments, it's very common for those to just blow away all the stuff that you tried to impart. And so the other point of that is not to ignore that and not to just kind of keep pushing through it. The thing I'd like to leave people with is the sense that you can have patients hope for the best and do some planning at the same time, and those do not necessarily have to be totally logically consistent. Allowing some inconsistency, which I called minding the gap, I think that is totally okay and an important tool to use, especially when you're working with patients in the early phases of illness.